Go ahead.
Hi, my name is Robin Hogan, and I am the Director of Quality at Bayfront Health Spring Hill Hospital in Spring Hill, Florida. I have my boss here with me. She is going to be observing me do this presentation for my Grand Canyon University class. So first I want to talk about our mission statement here, which during this class we found that it was important to tie in our mission statement with everything that we do, because that is the foundation of what we do here. And our mission here is to be the best healthcare provider and take care of our patients the best way we can, and to enhance our community experience. So the objectives of this enhancement, which my goal here is to enhance the education of our charge nurses. The objectives are to help them grow, to help them learn, and by doing this will also decrease the nursing shortage. So, and there is a huge nursing shortage here in Florida. They say by 2025 there's going to be a 40% reduction in the nursing staff. So one of the positive things about education, it helps to improve the workplace, and that also will help with retention with our older nursing population. So I'm going to increase patient satisfaction scores, which is another reason for improving education. A knowledgeable nurse will be able to understand in a better way, helping to care for patients with an understanding of knowledge behind them. The increasing in staff satisfaction by growing and learning, it's also going to help increase their satisfaction. This will also help improve physician satisfaction scores and make them have a more collaborative relationship. This will also improve patient return rates, because with the enhanced knowledge of the staff, patients are going to want to come back to our hospital, and we should see some kind of increased return rate, possibly even enhanced elective surgical procedures. So I'm working with the strategy map pillars here, and it's financial, customer, internal, and learning growth. Okay, so these are the pillars that I'll be working with. And I'm here seeking your approval. You are the stakeholders of our hospital, and the reason why I need your approval is this education may not be able to be completed on company time. So the nurses may have to come in on off shifts, which would cause an increase in financial burden to the hospital. So I do need to seek your approval for that. But once I get through this presentation, I know you're going to really agree with me and want to agree with me on letting these nurses do this. So our strategy map, our cause and effect diagram, so we're going to expand the knowledge of the nurses, and they will be able to care for our patients in a better way. Our customers, they're going to see that we have a better caring population of staff, and also will enhance our safe environment. The internal process is, it's going to, as I mentioned before, enhance staff satisfaction, and learning and growth, once again, is going to enhance staff satisfaction. So my implementation plan, there's going to be 4 core meetings, and they're going to be mandatory for the charge nurses to attend. I'm going to have 4 presenters do a presentation that will probably last anywhere between 35 and 40 minutes, so it shouldn't be long, but the whole class will be for an hour, and the last half of the class will be for question and answering. So I'm hoping to do some kind of interactive class with them so that we can really have a more meaningful education time. There will be 4 presenters, and they'll be doing quality of care and regulatory standards. It's important for these nurses to understand what makes a hospital tick, who we have to answer to, why we have policies and procedures, and all of these other mandates that we have to follow in order to comply with all these regulatory standards. And they don't know this right now. They're just working on the floor. They don't really understand the importance of all these regulations that we have to follow. Customer service is key. We do a program called Compassionate Care, and they need to understand the meaning behind that. They are going to have to be the leaders on their units and have to teach the newer nurses how to perform compassionate care, be a real listener to the patient at the bedside, instead of just doing task-oriented projects. The financial and budget planning. No one upstairs on the units really understands the burden that hospitals have to endure on a regular basis, managing the admissions, managing visits, managing billing payments, managing managed care, just for that matter, and the reimbursement factors that we have to deal with on a regular basis. So it's really important for them to understand that. And the last thing is going to be learning and growth. This incentives to move ahead. So I'm hoping that after they have gone through some of this training, that the next step may be another college degree for them, or learning something in a more specialized area of the hospital, so we can also cross-train them to work in different areas. That will also help with the nursing shortage. My initial rollout, big announcement, everyone's going to know. We're going to send emails. We have a program called 360 where they get direct information that's going to be sent to them, so they'll all have a clear understanding of the expectations that'll be for the classes that they need to attend. Verbal discussions, we have a safety huddle every morning. This information is going to be shared to the directors as well, so that they can also start, sharing the information with their charge nurses. But as I mentioned, it is going to be mandatory. And in the end, how am I going to evaluate whether this has been successful? Well, I'm hoping to see that there's going to be some increased satisfaction scores, some increased admissions, and as I mentioned prior, some increased elective surgery. I'm going to use the feedback control method, so I'm going to ask for questionnaires or surveys to be completed so that I can truly get an understanding of what their thought is on what the training will be and how best to improve. If they have additional critiquing, I can move forward to improve the program as we move along, because this is something I'd like to continue as we get new charge nurses on board. So this is not something that's going to be a one-time deal. It's going to be something I'm hoping to move forward with years to come. So that's my project, and thank you for listening.